we get quite a bit of comments of, the doctor put on a splint cast and then I've got to go back in 10 days later for a cast. And, why do I have to do that?
Certain fractures will swell a lot, and you need to accommodate that. It's one of the reasons we tell folks from the ER, don't make an appointment right away, because you'll just come in and have to get splinted, and then we have to bring you back in a week, 10 days and change it. Now, that's not true for all fractures, but when we put a splint on, for the most part, we're expecting it to swell. And you can make a splint very strong. Splint can be just about as strong as a cast. You have to pay particular attention to certain aspects of it. But if you put a hard circular cast on something that's going to swell, the pressure that's created can be really, really severe. So that's why we'll put a splint on.
And so why do some people feel the pressure? You brought up another question. So like if you put like a tight coat or something, or a pair of socks over it or something like that, why do some people, not often, but I do hear this occasionally, they feel the pressure around it and it hurts them?
Yeah, that's a real balancing act. When you're casting a fracture, there's an old saying, it takes a crooked cast to make a straight bone. So if you have a fracture and the fracture wants to angle this way, you actually make the cast with a little bit of a bend this way. Avoid that. So we would look at casts when we're training people, and if the cast is perfectly straight, first of all, it's a tube that has a greater chance of slipping off. But also you have to consider which way is the fracture likely to drift, and your cast should counteract that some. And that balance of how much pressure to put on there and that tightness is really really a skill to have. And so if you're having pressure, that's the time to really super elevate it. Just whatever it takes to keep it up with pillows, because a little bit of reduction in swelling can make a big difference in how you feel. And if you keep it down, and you know this, if you sprain your ankle or hurt your foot, you put it down in the morning, that first morning it's like, wow, what happened? And it's just because the blood's rushing down there. So some pressure inside is not always bad, but you need to be cautious that it doesn't keep getting worse.
Great.